Hi, welcome to Ask Dr. Pelto this week. We're going to go over a few cases that and questions that patients had this week for us. So let's start here. We're going to talk about a patient that had just a simple question, but something that we get all the time is after we do a permanent nail procedure called a matrixectomy, is it infected or not? We're going to go over a patient actually that I put this fake toenail on. It's called Keryflex, and she cried. So for 9 years, she hasn't worn nail polish or even worn a sandal, and she was very sad. And we'll talk about a treatment that can be done for that a lot of podiatrists do. Another question about metatarsal fractures. This is one of the questions that someone asked me on YouTube. And then also just a question about nail fungus. So let's get into it. What do I do with ugly toenail? That's what patients ask me. And a lot of times these are questions that go unasked because they're ashamed of their toenails. This patient, she hadn't worn, a similar patient, not this actual patient, she hadn't worn nail polish or sandals for 9 years. And when I did this procedure on her, she cried. She was so happy. So this is something that a lot of podiatrists do. There's a link underneath. It's called Keryflex.com, and it works very well. It lasts for maybe 6 to 12 weeks. And it's not a fake nail. It's actually a resin that's applied, and it works really well for the summertime. You can paint over it. So something to consider. A patient asked me as well this week, what can I do to speed up nail fungus treatment? You can't do anything to speed up nail fungus treatment because, well, I guess you could do biotin, and I did put a link underneath on biotin. Biotin helps nail and hair growth, but to speed up nail fungus, you have to have the nail grow out faster and choose the correct treatment. There are a lot of different treatments. I tend to still recommend the oral antifungals best, but if you can't take them or don't want to take them, then the laser is an option that we do and other doctors do. I don't think the topicals really work that well. I'm sorry about everyone that says that. I just haven't seen the best results in my practice with the topical. Also, you have to make sure it really is a fungus, so a nail sample is important for that. This is the main question I got, and I wanted to address this. This patient, she said, I've had 5 metatarsal fractures, so all 5 were fractured. I broke them. I can't find any info on these fractures. They are rare. I'm almost 3 weeks in, so basically just be aware, fractures, one single fracture might take 6 to 8 weeks. When you have all 5, it's going to take a lot longer. My ortho says surgery is not needed because they are aligned. I'll explain a little bit more what that means. But since I last saw him, my swelling has gone down, and I have a visible dent, a ½ inch. So that visible dent is usually due to swelling, and the pain radiates up through my foot to my knee. And I got a follow-up x-ray on Friday. I'm worried that he may not have experienced with this before. 5 metatarsal fractures, not many people, but most people have seen a fracture. I have a boot and can't wear it, causes too much pain. I'm currently non-weight bearing. I would agree with you. So I took a couple of examples of fractures, and I want to show about alignment. So for example, this one is shifted down a little bit, and you can see it's actually shortened the length of the metatarsal. If you catch it early enough, you could try to pin it and to bring it out to length. That's the whole goal. This one here, it's shortened a little bit, but gosh, it's hard. It looks like there's 2 fractures here. So to pin this would be very challenging. You may just leave it the way it is, and then you'll deal with any pressure distribution problems in the future. This one looks like okay alignment. This one's kind of off, and this one's off a little bit. Just so you know, it's amazing. You put a metatarsal, 2 pieces of metatarsal in a room together, and they're going to heal. It's just a matter of how long. So some people would advocate a bone stimulator, staying off of it. Some people would advocate doing surgery on this. But if they are in kind of alignment, just let them heal. And it's going to take a long time. That's the key. You're going to have swelling a long time, probably up to a year. With all that swelling, it might push against the nerves. So you might have some nerve pain as well. So those are some things you have to think about. And then the last question, patient came in, and this happens a lot, more than you'd think. After they had a matrixectomy, that's where you kill the root with an acid. We use sodium hydroxide, and they have this redness at the base. This redness is normal. This actually isn't that bad. There could be redness, there could be swelling. It's not an infection, it's just redness, and that's kind of the issue with this. Okay, so I hope that helps you. If you have your own question, please ask it. You can go to drpelto.com and ask if there's a place to ask me a question. You can also put it at the end of the video. This does not constitute medical care, just so you know. This is educational only. So you should really seek your own doctor for help. And also, if you want to schedule an appointment, you can also do it at drpelto.com if you're in Massachusetts. Okay, hope you enjoyed this week of Ask Dr. Pelto. Ask me your own question. I'd be happy to answer it.